All right. So welcome to another edition of the Deals for Dentists podcast. And we have the man with the plan here. We have Dr. Alden Cass, clinical psychologist and performance coach. And he coaches high-profile Wall Street executives, entertainers, athletes, and professionals working in high-intensity professions. Hey, thanks for joining us.
Thanks for having me, Eric.
So I say the man with the plan because we actually went to Nova together, and back in down in Fort Lauderdale. And after school, you were like shot out of a cannon, right? You knew what you were doing. You finished up at Nova, which was what, a 4-year clinical psychology program.
Yep, doctoral program. I think it was like 2001 or 2000, something like that.
Yep.
And yeah, no, I mean, you and I had talked about it, like even back then, that I did this research, the first clinical investigation on the mental health of Wall Street stockbrokers in 1999, and the results that came out were, highly publicized, and that actually launched me into the Wall Street psychology world, and helped me focus on a target population that was underserved and undernoticed in terms of clinical issues, which is very common for other professions as well, including dentists and doctors and lawyers, other professionals who are dealing with high levels of stress and have a huge amount of responsibility on them.
Yeah, so I think you made such a good point there that it's kind of an untalked about or unknown thing with clinical psychology and stockbrokers and people just under high pressure jobs, and dentistry is definitely one of those. Now, do you work with health professionals as well, like doctors, dentists?
Yeah. Yep, I have dentists in private practice and boutique offices, ones who have their own practices for 25 years, 30 years. I work with, plastic surgeons. I work with surgeons in the ER. So anyone who's dealing with, high levels of stress, business building, in addition to the stresses of having to deal with, a patient population that's very, that's needing a lot of help and support at a very uncertain time in our lives.
No, I also saw you have one of those pictures where you're leaning your chin on your fist, and I definitely need to get one of those. That's like instant credibility when you have one of those photos on your website. So
yeah, it just shows that you're thinking a lot.
You're thinking, yeah, and you're an authoritative figure. So
yeah.
I need to do one of those. So now, so you work with anyone under a high pressure job. I couldn't even imagine, like being a surgeon and you have someone's life in your hands. I mean, what's the worst happens with me? Someone loses their tooth. At the end of the day, I go home and
your mouth is correlated with cardiovascular health. So that's very important, life or death.
Very true. And I've had plenty of people cry in my chair when I've told them that they have to lose, their tooth has to come out. But at least that patient is walking home at the end of the appointment. Whereas a surgeon, when they have someone under their knife, they control that person's life in their hands. That's got to be a tremendous amount of stress.
Yeah. You have to become extremely depersonalized in these professions so that you don't, really experience the emotions which the emotion is usually anxiety, fear of failure, fear of not being perfect, and making mistakes. So all of those feelings, left unchecked, can really do damage to someone's mental health or overall performance. And that's why it's important from an insight standpoint to understand that that's what's going on. And part of what I do is get under the hood with these individuals and help them not only identify what they're feeling in the moment, but to help manage it so that it's done in a way that doesn't affect their overall performance.
So do you do one-on-one coaching? Is that the bulk of what you do?
I do one-on-one coaching. I do tele-coaching. I do group team building kind of scenarios where I work with offices, help, dentists and dental hygienists and the whole office environment become more cohesive, more productive, more efficient, help people understand each other, um, dealing with partnership issues between doctors and big partnerships and practices. And so, I've been called in for those types of things.
And you mentioned the fear of failure. That was one of the big issues that I had with anxiety when I was an associate. And I always wanted to, please everyone. I wanted to make all my clinical work perfect. I wanted to please the staff, please the owners. I didn't want to get involved with any confrontation. So I wanted everyone to like me. So that created a lot of anxiety for me and a lot of stress because I'm an introvert, so I kind of kept everything on the inside. So over years that kind of built up, and I was just always so nervous all the time talking to patients. I was always afraid of getting sued. I'd be doing the simplest procedure, but I was so nervous about not doing a perfect job, or if that patient didn't like me. Also, I looked like I was 12 when I graduated, so there
You
was
and me
that
both.
yeah. So there was that. So as a young dentist coming out of school, there's that that kind of that imposter syndrome where
Totally.
I'm trying to present a treatment plan to a CEO of a company or a physician, or I didn't feel like I was worthy enough of giving them my treatment plan. So, do you find that is very common with people that have anxiety?
Well, I think all of the above. I mean, I myself came out of my doctoral program looking like I was 20, and had to deal with the same imposter syndrome that you yourself talked about, as well as the anxiety of building a practice and feeling like I needed to be perfect, and a fear of lawsuits and all that stuff. I mean, it's a very common experience for anyone. But really, what it comes down to, when it comes to fear of failure, um, in my world, or how I perceive that topic, it's failure is not an option. The only failure is if you actually don't actually do anything. And if you don't try and you're not in the game, if you say no to things that, people are asking you to try, even if it's out of your wheelhouse, like, get good at it, learn how to be, say yes to everything and achieve, like, push yourself to be better. But there's no failure. Even if you do it wrong, you can't actually fail. Um, you can only learn from those mistakes and grow as a practitioner.
Yeah, I think that's great advice, and especially the part where you said, do something about it, take action. Because I was going through this period of time where I had to do something because I just looked at myself in the mirror and said, "There's no way that I can continue to practice like this for the next 30 years and have this, anxiety and dread going into the office every day." So I made a lot of changes, started going to a therapist myself, combination of some medications. Took a while, but it took years. But now I actually am back at the point where I enjoy going to work every day. And at first I had to realize that I had a problem, which was the anxiety. Then I had to take the action to see a therapist and make all the changes and follow through with those actions. So it's funny, we both came out of school looking young, because Fort Lauderdale, 4 years down there should age you, but
It doesn't. No, it keeps you young, man.
keeps you.
It freezes you in time.
Yeah, it was all that suntan lotion that kept
Yeah.
our skin
Yes, nice and
nice.
bronze. Yes.
Yeah. So is your company called the Competitive Streak Consulting?
Yeah, I have two businesses. My professional coaching, performance coaching practice is called Competitive Street Consulting, and my therapy practice is called Intervisions Psychological Services.
Okay. And do you treat patients nationwide, internationally?
Internationally, I've been doing teletherapy, telecoaching, and basically, I have a practice in Midtown Manhattan.
Okay. So do you actually still go into your office, or is it all virtual now?
I mean, I've been there twice since March. So,
Yeah.
I mean, most of my clients prefer to see me remotely, which I don't mind at all.
Yeah.
Keep it coming.
Yeah. That actually is, you are ready and prepared for,
Yeah, I've been doing telecoaching for 10 years. So this is nothing. I've been waiting for this day.
So wow, I'm looking at your list of, professionals that you work with: venture capital executives, hedge fund traders, investment bankers, lawyers, film producers, executives, singers, dancers, athletes. You work with pretty much with anyone that needs to perform and is in a stressful and competitive environment.
Mm-hmm. And back to your point, there was a time for each one of those professions that I worked with that I had never worked with that type of person before, and I was nervous about taking it on, and saying, can I affect them? Can I impact them in a positive way? And I was nervous initially, but when I was asked, can you do this? My first response was yes, and I'll figure it out. I said to myself internally, but what I spoke was with conviction. Yes,
Mm-hmm.
I got this. I can handle this totally. And then I used all the other high profile and high stress type of interventions that I've done before as my anchors. We call them cognitive anchors, to base my thinking on the present, saying, well, I've done this before, and here's my evidence for that. And as a result of that evidence, clearly I can handle this too. And I'll figure it out and I'll be successful. And that made the anxiety go down.
Now, did you initially start with Wall Street? Was that your first set of clients?
Yeah, and then everything just became it trickled out from that because everyone saw the overlap and the synergy.
And so I think what you said there was really important. So as a young dentist, you come out with minimal, the bare minimum of skills, and you need to hone your skills, and you need to present that treatment plan to that patient with confidence and conviction, because if you're not confident in what you're presenting to the patient, then they're not going to be confident that you're going to be able to do a good
Mm-hmm.
job, or that they're going to trust what you're treatment planning. So and it's tough for a young dentist to, they don't teach you how to, the psychology of speaking to patients or presenting treatment plans or educating patients. In school, the patient was just like not even there. You'd talk over them, you'd talk about them, and it was just not real world experience. So getting out, it's just a totally different, ball game.
Mm-hmm.
So you're dealing with the patient communication aspect, and you're trying to hone your clinical skills. And then you have a lot of dentists that become business owners, and they have absolutely no business background. So all these things can really compound and create a lot of stress. So what is, and I'm going to probably totally butcher this, CATS G scan?
That's it's kind of a non-clinical assessment a profiling report that I do with my clients, my coaching clients, to help them understand themselves based on what motivates them. What is some of their behavioral tendencies that they need from work in order to motivate them. So it's a 30-page report that basically is an X-ray, almost like a CAT scan, which is why it's called the CATS G scan, that gets under the hood and helps me as the coach help guide their treatment plan in terms of focusing on goals and what are some of the blind spots they may have in their overall behavioral tendencies towards their job and their performance at work. So this is more of a generalized report that points out behavioral tendencies of a person that might get in the way of their job, or it will show me what areas there might be what I call psychic leakage or emotional leakage when there's a disconnect between a person's natural style for behaving or performing, the traits you're born with, and if there's a break between that and their adapted style, what the work environment or workplace actually forces one to deal with on a daily basis. So as that gap widens, a person becomes more burnt out, emotionally exhausted, and overwhelmed.
And now you mentioned goals. Is that a big part of trying to, the healing process of, getting through these leakages is figuring out your goals? And do you have every client kind of come up with a list of their short-term and long-term goals?
I mean, yeah, we pretty much, you know, within the first hour can figure out what their immediate goals are. Because I'm usually having to put out fires initially, and then we
Hmm.
get to more longer term substantial goals as time goes on, figuring out, where when they're all clear minded, how I can get them to the holy land.
Yeah, typically, and I'm sure it's totally different for everyone, but how long is the process where you start to see, breakthroughs, or does it take a lot longer for some people than others to really kind of get comfortable with themselves and start to perform better?
Yeah, I mean, everyone pretty much starts at a different exit ramp on the LI on the New Jersey Turnpike. Some further ahead than others, so it all is different in terms of how long it takes. But I mean, I've had clients who've seen results within a month, and I've had clients, as soon as 2 to 3 months, and then probably the average is 6 months.
And is that, typically meeting with you once a week, twice a week?
Once a week.
Yep. And is it usually like an hour long session?
Yeah, 50-minute session, 50-minute hours. And then I, often give a lot of homework between sessions that we kind of go over on, during our sessions weekly. Um, you know, a lot of the stuff I do is relating to my bullish thinking paradigm, which was in my book, uh, Bullish Thinking, The Advisor's Guide to Surviving and Thriving on Wall Street. And, a lot of my clients, no matter what profession they're in, I would give that book to dentists. I would give them to lawyers or musicians in rock groups, and it applies the concept of bullish thinking and creating emotional discipline when things are against you, or things or times are uncertain or unpredictable. It would apply to anyone.
That's interesting. So it's all basic principles that you can apply to, to any type of high stress, high performing profession.
Mhm.
So at Nova, was that a 4-year program of clinical psychology?
Well, I was 4 years there, and then a fifth year I had to do an internship, which I did at St. Luke's Roosevelt Hospital in Manhattan, and then a 6 year postdoc, and then you're done. So it was a long time.
Okay, so you were 6 years after college.
Yeah.
Were those two? So you was 4 years of clinical psychology, and then you had the internship, and then the 6 year. Is that a requirement, kind of
Postdoc?
nationwide? Yeah.
I don't know if the postdoc is, but the internship was.
Okay. Yeah, like, in dentistry, after 4 years, we could, once you pass the boards for the region, then you could, open up shop and, start your own
Right,
practice. Yeah.
right.
But, I find that I did an extra 2-year program at BU because I was just not ready to go right into private practice.
You were having too much fun in Florida for those 4 years.
I had to cool off, I had to come back up to Boston and cool
Yeah,
off. But
yeah.
so for me, I just wasn't ready.
Mhm.
Um, Now, is a lot of what you teach your clients them kind of getting comfortable with themselves? And I was a psychology major at Tulane, so I'm kind of an expert. But does it all go back to your childhood and getting comfortable with yourself and your childhood? Is that a very common theme?
I mean, not really in my office. I'm not, that would be much more of a psychoanalytic kind of orientation or background to hit that mark in terms of making drawing that link between why someone's not succeeding today versus like their childhood. I mean, clearly there are things from your childhood and growing up that you learn from your parents, and like, you watch your dad as a male, and you watch your mom as a female. like, or vice versa, and you witness things go on. But really, I mean, a lot of the stuff I'm dealing with, I mean, the fear of failure and all that stuff and lacking confidence, that comes from self-esteem, and self-esteem is built up through, obstacles you've overcome in your life. And the more you have to face early on, the more you overcome it, the more resilient you are in the face of setbacks as you get older. So, you know, I, and then there are people who have way too much confidence, and that works. That works in a positive way from the vantage point of being noticed, but it also opens you up for a lot of problems when you make mistakes.
Yeah. Yeah, the fear of failure was a big factor in me getting through school. I feared failing and
Mhm.
flunking out of dental school, and that was kind of how I got through school. Was just I didn't want to fail. I
Mhm.
also didn't want to disappoint. So after school, and I'm not sure what that was all about, but I just didn't want to disappoint my patient. I didn't want to disappoint, as an associate, I didn't want to disappoint the owner, um, the staff. I wanted everyone to like me. Um, and the way I put it is I was saying no to myself and yes to everyone else.
Mhm.
Whereas now I'm more comfortable in my skin and being a leader and an owner of an office. And I say no, I say yes to myself and no to other people more, meaning, um, no, this is the way it is. This is the way I want the culture of the office to be, or the system of the office to be. Um, so that was a big turning point for me in not having to please everyone, and getting over the fact that if I say no to someone, such as a patient, if I say that I don't want to treat them, they're not a good fit for me, um, then I'm fine with that.
Mhm.
Or if I presented a treatment plan and they said, no, I don't want to move forward with that treatment, that's also fine. I gave them,
Mhm.
the options, and I presented it, and I'm confident in myself with,
Right.
so that was a big turning point in me in that,
Mhm.
uh, and kind of getting back to, avoiding burnout and enjoying practicing again.
Yeah, you should definitely read chapter 8 of my book on assertiveness, because that's a whole chapter on how to ask for what you want and tell people what you need in a way that is honest, respectful, and direct.
Hmm.
Where if you follow the script or the formula that I provide for assertiveness, you will come away with way more wins, and the belief that you're not going to rock the boat by saying what you need and telling
Hmm.
people what you need.
And I think I'm probably chapter 8. I'm like, my whole initial part of my career was chapter 8.
Mhm.
Now I'm in, what's the final chapter? Because now I think I'm in that final chapter. Was that 12? How many
My
chapters?
12, I don't even remember. I haven't read the book in years, but it's probably close to 12 chapters.
There you go. Um, so what kind of advice would you give for a young dentist that's struggling with their mental health, anxiety, and they're starting to suffer some burnout? What would you recommend for them?
Well, I'd get, there's plenty of resources out there, and currently they're remote, which is ideal from a time management standpoint. So take advantage of that. Figure your stuff out now, because you can't be helpful to a patient if you yourself have internal chaos going on, and you're not your best self, because you cannot practice with conviction in the face of people who are just traditionally anxious seeing you in the first place. So you have to be your best self. You have to be the rock. You have to be the captain to your clients. Make them feel like you will help them get through what they will probably perceive as a stressful, anxiety provoking visit with you. It's not like people don't view going to a dentist like they view going to Disney World. It is not the same. So the assumption should be your patients need a lot of reassurance and handholding, And you can't do that if you yourself don't have your stuff together. So, the second thing I'd also advise is really maybe even hire yourself a business coach. Find somebody as a mentor who has run a business successfully, because there's a lot more to it, to running a business than just being a dentist. So, you really have to think outside the box and learn how to, run a business successfully before you can actually go off on your own.
That's such great advice. Also, what about peer engagement? Because especially solo practitioners, they're in their own little bubble where they're isolated in their office, and it's not like where if you work in an office building where there's tons of coworkers and you go out for a beer at 5 o'clock after, you're kind of isolated in your own little bubble. Do you find that peer engagement or finding mentors and reaching out is a great way to reduce anxiety?
I think that that's obviously a very progressive way to manage stress. I think it's great. I think peer group relating to your profession, those types of support groups are amazing. They exist. They exist in my profession. I just personally don't usually get along with other psychologists. That's why I hung out with the dental school guys.
That's right.
But the reality is that sometimes people do need that connection to other people that are not doing, or that are going through the same hurdles and stresses, and hearing how they're running their business and what pitfalls they've gone through. It's always helpful to hear that in times of crisis. And again, that's why I think it's important to have a therapist or to have a coach, somebody who you can help you get through times of crisis, so you don't worry about things so much. You could stay focused on meeting your bottom line financially and taking good care of your patients.
What about because of COVID? Have you found that there's just in general more stress or more depression out there with your clients, or are you busier than ever because of the pandemic?
No, I think I'm dealing with a lot more marriage therapy than before. but it's because I think people are working remotely for the first time and everyone's on top of each other, and it's causing a lot of conflict that wasn't happening earlier. But I mean, it's no more or less. I saw more of an uptick of problems during right before the election than anything.
Hmm. And just curious, do you find that there's some people that just end up leaving their profession? It just wasn't for them. The stress was too high. There was too much burnout, and it was just better for them to move on and find something else to do.
I've seen that happen more with lawyers than any other profession. But I feel like that's because they can go out and do other things that relate to having a law background. I haven't seen many dental or plastic surgery or any of these other professions, optometry, just shift gears like that. And I think it's partially due to how much money you've invested in your careers and the time you've put in, and to just give it up it would have to take a lot of, for one to decide that. But, for the most part, you have to find ways to grind through and think about your job on a daily basis with a healthier mindset, one that's more adaptive. And that's the principles of my bullish thinking would teach you that.
Yeah, you nailed it. That some of the kids coming out of school now are $500,000 in debt, and they don't have the option to just quit and find another profession. They've got to power through and get comfortable. What about addiction? Dentists have the means, they have the stress. Are you finding that in professions such as dentistry or other health professions that there's a correlation with addiction?
Oh yeah. I mean, dentists have one of the highest suicide rates of any profession, as well as addiction rates, and it's because of the the high levels of stress and the immediate access to certain types of medications that are easily abusable and highly addictive. So yeah, I mean, it's always been a concern with the dental clients that I've worked with.
Do you have a group that you work with for drug therapy or addiction therapy that you refer
I,
to?
I mean, I've referred clients to rehabs before all over the country, and I work with addiction psychiatrists in New York that help medicate and help take clients off of these addictive substances once they're hooked.
Mm-hmm. Wow, I mean, that is really, really scary to think that, you know, you go through all these years of school and all this time invested, and it could happen. You know, you have dentists have the means and the access, and could easily, you know, get addicted.
Mm-hmm.
Um, so thanks so much for joining us. That was really informative. Again, Dr. Alden Cass, clinical psychologist. Do you think you're gonna end up retiring back down in South Florida when it's all said and done?
That's the plan. That's the plan. Next 7 years are crucial to making that happen.
Yeah, that's the master plan. Yeah. Well, again, thanks so much for joining us, and let's be in touch.
Definitely. I'll speak to you soon, and thanks for having me.
Sounds good.
All right. Bye bye.